We will continue with Mood Disorders, Chapter 23. This will be Part 2. However, for your student PowerPoint slide, you can continue on as you have been because there is only one PowerPoint file. Although there are several factors that contribute to antisocial personality disorder, some of the causes can be psychosocial factors, which are at-risk children, poor child-parent interactions, truancy, theft, disobeying parents, frequent lying with no remorse, and children who were abused sexually or physically. However, biological factors can also contribute to the cause of antisocial personality disorder. Early appearance of aggressive behavior and tantrums are one cause. MRI scans of the brain show that people with antisocial personality disorder have 11% fewer brain cells in their prefrontal cortex. This is responsible for making decisions and planning. Researchers have hypothesized that damage or malformation of the prefrontal cortex increases the risk of antisocial personality disorder. In the treatment of antisocial PD, psychotherapy is not effective. Antisocial PD are people who are guiltless, mistrusting, irresponsible, and practiced liars who fail to see their behavior as a bad thing, and they don't want to change. Therefore, their best hope would be medications, antidepressants that raise levels of serotonin. Some researchers believe that abnormality in serotonin levels may be the cause for the impulsive and aggressive behaviors of someone with this disorder. Research studies have shown that people with antisocial PD who took serotonin increasing drugs showed a significant decrease in their aggressive behaviors. However, antisocial behaviors return when the patient stops taking these drugs. Other research shows that antipsychotic drugs can help decrease impulsivity, hostility, aggressiveness, and rage. In a 29-year study of 71 men who were antisocial PD, it showed that 69% showed no improvement in their behavior. It is a long-term problem that needs to be managed. The next mood disorder we will be discussing is schizophrenia. Schizophrenia is a mental disorder that lasts for at least 6 months and includes at least 2 of the following symptoms: delusions, hallucinations, disorganized speech, disorganized behavior, and decreased emotional expression. There are several subcategories of schizophrenia. The first one we will look at is disorganized schizophrenia. It is marked by bizarre ideas, often about one's body, like your bones are melting, would be an example of a bizarre idea. Confused speech, childish behavior, great emotional swings, and is often extreme neglect of personal appearance and hygiene. The next subcategory of schizophrenia would be classified as paranoid schizophrenia. This is characterized by auditory hallucinations, delusions of being persecuted by others, and delusions of grandeur. Catatonic schizophrenia is characterized by periods of wild excitement or periods of rigid, prolonged immobility. Sometimes the person assumes the same frozen posture for hours on end. I would like to go back to paranoid schizophrenia and just clarify that auditory means hearing, and grandeur or grandiosity means extravagant or really grandiose ideas that, because you bought a lottery ticket, for example, you're going to win the lottery tonight and you're going to win the million. That would be maybe an example of grandeur. So, what are the chances of recovery? Type 1 schizophrenia includes having positive symptoms such as hallucination and delusions, distortions of normal function, and no intellectual impairment, which is a good reaction to medication. So there is a good chance for a type 1 schizophrenia patient to have a good recovery. For type 2 schizophrenia, this includes having negative symptoms such as dulled emotions and little inclination to speak, which are a loss of normal functions. There is intellectual impairment, poor reaction to medication. Therefore, there is a poor chance for recovery. Some of the symptoms are disorders of thought, disorders of attention, disorders of perception, which would be hallucinations, motor disorders, and emotional affective disorders. Biological causes of schizophrenia are genetic predispositions or genetic markers that refer to an identifiable gene or number of genes or a specific segment of a chromosome that is directly linked to some behavioral, physiological, or neurological trait or disease. When looking at the neurological causes, we can see that 80% of brains of schizophrenics show larger than normal ventricles. In the frontal lobe, the prefrontal cortex, there is less activity of the prefrontal cortex. Frontal and temporal lobes are smaller. Environmental causes of schizophrenia can include incidences of stressful events and how individuals cope. For instance, they may have had hostile parents, poor social relations, the death of a parent or loved one, or a career or personal problem that can contribute to the development and onset of schizophrenia. One explanation for environmental causes of schizophrenia is called the diathesis stress theory. This is when some people have a genetic predisposition that interacts with life stressors to result in the onset and the development of schizophrenia. Neuroleptic drugs, also called antipsychotic drugs, are used to treat serious mental disorders such as schizophrenia by changing the levels of neurotransmitters in the brain. Typical neuroleptics primarily reduce the level of the neurotransmitter dopamine. Dopamine theory is when dopamine transmitter system is somehow overactive and gives rise to a wide range of symptoms. The treatments, antitypical neuroleptics like clozapine, Risperidone, lower levels of dopamine, and also reduce levels of other neurotransmitters, especially serotonin. The use of typical neuroleptics in the treatment of schizophrenia can cause tardive dyskinesis, which involves the appearance of slow, involuntary, and uncontrollable rhythmic movements and rapid twitching of the mouth and the lips, as well as unusual movements of the limbs. It also can include the other symptoms listed. However, the treatment of schizophrenia with atypical neuroleptics is very low rate of tardive dyskinesis. It can cause increased levels of glucose or blood sugar, however, or the onset or worsening of diabetes and excessive weight gain. The last mood disorder we will look at is dissociative disorders. These are characterized by a person having a disruption split or breakdown in his or her normal integrated self, consciousness, memory, or sense of identity. Dissociative disorders, again, are, to sum it up, a break from reality where someone breaks off and they may not be fully in touch with reality. The first one we're going to look at is dissociative amnesia. This is characterized by the inability to recall important personal information like your name, your address, where you live, who you are, or events, and is usually associated with stressful or traumatic events. Dissociative fugue is a disturbance marked by suddenly and unexpectedly traveling away from home or place of work and being unable to recall one's past. Dissociative identity disorder is the last dissociative disorder that we will look at today. It was formerly called multiple personality disorder. It has the presence of two or more distinct identities or personality states, each with its own pattern of perceiving, thinking about, and relating to the world.